Hi all, welcome to another video of NS Pharma. Today we will see important multiple choice questions from the Pharmacology chapter Cardiac Glycosides and Drugs for Heart Failure. Cardiac Glycosides and Drugs for Heart Failure. So we will see the first question. Digitalis increases the force of contraction, that is, it will increase force of contraction of ventricles by, that is positive, it is called force of contraction, increases the force of contraction, which is called positive inotropic effect. Inotropic effect, that is force of contraction, increasing the force of contraction, inotropic effect. So Digitalis increases the inotropic effect, that is positive inotropic effect, by, or increases the force of contraction of ventricles by option A, increasing the duration of systole, option B, increasing the rate of contraction without affecting the duration of systole, option C, increasing the rate of contraction but reducing the duration of systole, option D, increasing both rate of contraction as well as duration of systole. We have noted this, Digitalis normally reduces the duration of systole and it will increase the rate of contraction. The correct answer for this question is option C. Digitalis have positive inotropic effect through increasing the rate of contraction as well as it will reduce the duration of systole. Now we will move to the next question, question number 2. Digitalis slows the heart in the congestive heart failure, CHF, congestive heart failure. Digitalis slows the heart in the congestive heart failure by option A, increasing vagal tone, option B, decreasing sympathetic overactivity, option C, direct depression of SA node, option D, all of the above. Digitalis slows the heart through increasing vagal tone, decreasing sympathetic activity, overactivity, option C, direct depression of SA node, option D, all of the above. The correct answer, all of the above. Next question, question number 3. What are the consequences of myocardial sodium potassium ATPase inhibition by digoxin? This is the mechanism of digoxin, myocardial sodium potassium ATPase inhibition. So here the question is, what are the consequences of myocardial sodium potassium ATPase inhibition by digoxin? Option A, it will increase the intracellular sodium ion concentration, increase the systolic calcium ion concentration, cytosolic calcium ion concentration, increase the intracellular potassium ion concentration. Option D, both A and B are correct. The correct answer for this question is option D, both A and B are correct. That means through sodium potassium ATPase inhibition, it will increases intracellular sodium ion concentration as well as it will increases cytosolic calcium ion concentration also. We will move to the next question, question number 4. The most important channel of elimination. The most important channel of elimination of digoxin. Option A, glomerular filtration, option B, tubular secretion, option C, hepatic metabolism, and option D, excretion in bile. The correct answer for this question, glomerular filtration. Question number 5. Select the most suitable antiarrhythmic drug for counteracting ventricular extrasystoles due to digoxin toxicity. Digoxin toxicity causes ventricular extrasystole, which is a type of arrhythmia. So the drug which is used for the treatment of this ventricular extrasystole due to the digoxin toxicity is option A, lignocaine, Option B, quinidine. Option C, verapamil. Option D, amiodarone. The correct answer for this question is lignocaine. Lignocaine is used for the treatment, or it's used as antiarrhythmic drug for contracting ventricular extrasystole due to digoxin toxicity. The antibody which is used against digoxin toxicity is Digibind. The antibody against digoxin toxicity. The extracardiac adverse effect. This is one of the cardiac adverse effect of digoxin toxicity. The other that is not related to cardiac, their adverse effects are anorexia, nausea, vomiting, abdominal pain are some reported cases. Now we will move to the question number 6. Digoxin is contraindicated in. Digoxin is contraindicated. We cannot use digoxin in. Option A, angina pectoris in patient. Angina pectoris patients. Option B, ventricular tachycardia. Option C, hypertensive patient. And the option D, complete heart block. The correct answer for this one, digoxin is contraindicated in option B, ventricular tachycardia. This is one of the case where digoxin is contraindicated. One other case is Wolff-Parkinson's-White syndrome. In that case also digoxin is contraindicated. Wolff-Parkinson-White syndrome. In this case also digoxin is contraindicated. Now we will move to the 7th question of this video. The preferred diuretic, the diuretic of choice, the first choice diuretic for mobilizing edema fluid in CHF in congestive heart failure. Option A, hydrochlorothiazide. Option B, furosemide. Option C, metolazone. Option D, amiloride. The preferred diuretic for the mobilizing edema fluid in the CHF is option B is the correct answer. Furosemide is useful in this case. Now we will move to the next question. Question number 8. GTN, that is glyceryl trinitrate, is used in the CHF for. Glyceryl trinitrate is used in the CHF for. Options are routine treatment of mild to moderate chronic heart failure. Option B, rapid symptom relief in acute left ventricular failure. Option C, arresting disease progression. Option D, both A and B. So GTN is used in CHF4. The correct answer for this question is option B, rapid symptom relief in acute left ventricular failure. GTN is used in CHF4, rapid symptom relief in acute left ventricular failure. Now we will move to the next question. The following type of vasodilator is not beneficial. The following type of vasodilator is not beneficial in CHF due to systolic dysfunction. Options are calcium channel blocker. Option B, angiotensin converting enzyme inhibitor, that is ACE inhibitor. Option C, nitrate. Option D, hydralazine. The correct answer for this one, the vasodilator which is not beneficial in CHF is calcium channel blocker. Option A, calcium channel blocker. Now we will move to the 10th question. Select the drug which is an enodilator. Beneficial in refractory congestive heart failure. Select the drug which is an enodilator beneficial in refractory congestive heart failure. Options are nicorandil, amiodarone, ambrinon, carvedilol. The correct answer for this question is ambrinon. Ambrinon is a phosphodiesterase 3 inhibitor. 3 inhibitor. Okay, so why it is called enodilator? Because it has positive enotropy effect, and also it is a vasodilation. It's a vasodilator. So it is called enodilator. So it is known as enodilator. So we have note this ambrinon is also known as enodilator. The main adverse effect of this ambrinon is thrombocytopenia. Thrombocytopenia is the main adverse effect of ambrinon. Another PDE3 inhibitor example is milrinone. Another one is milrinone. Compared to this one, ambrinon, in case of milrinone, thrombocytopenia is not significant. Thrombocytopenia is not significant in case of milrinone. This is one of the important question. What is the difference between ambrinon and milrinone? Both are PDE3 inhibitors, while ambrinon has adverse effect of thrombocytopenia, while milrinone doesn't have. So these are the main important points regarding this chapter. And one more thing I will tell you, one we've already discussed, this one, digoxin is contraindicated in ventricular tachycardia. The question number 6, digoxin is contraindicated in ventricular tachycardia. Why? Because it may precipitate ventricular fibrillation. It may precipitate as ventricular fibrillation. That's why it is contraindicated in the case of ventricular tachycardia. In other cases, this digoxin is you had used in the precaution or as contraindicated in case of hypokalemia, myocardial infarction, thyrotoxicosis, myxedema, ventricular tachycardia. That was the answer here. Then partial AV block, then acute myocarditis, and also in case of Wolff-Parkinson-White syndrome. In these all cases, digoxin is contraindicated, or you can use digoxin with caution only. So these are the important points. Digibind, you had not this one. This is known as digoxin antibody. In case of toxicity, digoxin toxicity, we can use this antibody digibind. This one will cause diuretics. Digitalis will cause diuretics. Another important points, this one maybe you know, digitalis will cause hypokalemia. That's why I said you had to use digoxin in precaution when there is a hypokalemia. So digitalis causes hypokalemia. So thank you guys for watching this video. Hope this one you understood this class. If you like this video, please make thumbs up and also share with your pharmacy friends. Thank you.